Are you someone who has tried to quit smoking, but you really haven't had a whole lot of success? Well, maybe you're just not ready. And this lady right here sitting with me knows that very well. Marcella Bianco is the Tobacco Prevention Program Director with the Tennessee Department of Health. We really appreciate your time today,
Thank you,
Marcella. I say that you know that because you told me that when people don't have luck in quitting smoking, that is one of the key things. They just may not be ready to do so.
Correct.
You work, I know, a lot with statistics. You know how many people here in the state smoke, and it's still a big statistic, a big number.
Is. Yes, the state of Tennessee is 24.3% smoke, adults.
Wow.
And that's just cigarettes. That's not including ends, electronic nicotine, and nothing of that. It's just regular cigarettes.
How do we compare nationally?
Out of the 50 states, we are number 46th. So we have
got some work to do.
A lot of room for improvement.
That's right.
Yes.
The state, though, is taking some steps to make that happen, though, to help folks out there who are trying to do so, right?
Yes, we are. We just last month kicked off It's Quitting Time in Tennessee, which is it was a whole week-long promotion to promote cessation services. We have a free tobacco quit line. There's information and help out there free for those who are ready to quit.
So many people hear so often, you know, how smoking is bad for you, but talk specifically about health complications someone might endure if they continue to smoke.
There's so many, and we can go from the cancers, the lung cancers, COPD, and you can go to the little things like it can ruin your teeth. Your skin loses the elasticity and changes color. You know, you have a smell. Your fingers can actually turn a little yellowish with your fingernails. If you look at some smokers who've been smoking for a long time, you can see around their mouth, it's the little wrinkly from the puff. So it goes from the big things like cancer, where it's going to change your life, to just the daily little things, smell and taste. You know, some of the people who we've helped quit, they're like, I can actually taste my food now. And they think that, well, I don't want to, some of them say, I don't want to gain weight, so I don't necessarily want to quit. I'm going to eat all the time. It's like, well, you can taste your food. That's why you tend to eat a lot more.
I see, yeah. You know, a lot of people who actually smoke, I mean, you know, not everybody deals with the secondhand smoke, because now there's actually laws in place to where you would go to a public place and you don't necessarily, you can't smoke in those places. But some people are still exposed to secondhand smoke. Where would some other places be that people would still have to smell it?
Parks, outdoor places. I mean, we have some voluntary outdoor places that are tobacco free. In your home, in your car. Your clothing, which is the third-hand smoke, the second-hand, third-hand smoke. So if you have a brand new baby and someone, even if you didn't smoke, but say I had a cigarette and I smell like smoke and I'm holding your baby, that baby's inhaling that third-hand smoke from your clothing.
And it still poses a risk, obviously.
It does pose a risk, yes. The carcinogens are still in second-hand and third-hand smoke. It's called involuntary tobacco smoke because I'm breathing it in involuntarily. I'm not doing it because I'm taking the actual cigarette. It contains over 7,000 chemicals still just in the smoke that's been emitted.
Wow.
So to say that it's not harmful, it is harmful. It actually increases chances of lung cancer by inhaling secondhand smoke. And there's lots of cases and people who have lung cancer because of secondhand smoke.
You know, it's so easy when you hear things like that to tell people, well, just don't do it. But you know, that's hard. I mean, it's so easy to say, well, just quit.
Right.
But there are people who have smoked for years, I mean, a lifetime. So if somebody finally says, all right, I'm ready to do this, you know, because as we said in the very beginning of this program, you're not ready if you're not having success.
Right.
What is their first step?
Call their doctor. Talk to your physician. That's our biggest request, is that you talk to your physician, find out what type of therapy is out there for you that you can take. There's numerous different types of nicotine replacement therapy, but don't go take the patch if you don't know you're healthy enough to go take the patch. So we really want you to go talk to your doctor first. Then there's several other steps. You ask for family and friends for help, especially if you're trying to quit smoking and you have someone in your house that smokes, or your friends, your social group that you hang out with uses tobacco, saying, you know, I'm trying to quit, can you please help me? So seek help from others as well. We do have free services, like I mentioned before. We have the tobacco-free quit line that they can call for free and get help and get guidebooks, get free nicotine replacement therapy for 2 weeks if they're eligible from their doctor to receive it.
Tell people also, you had mentioned some of the ways that they can try to quit, whether it be gum, patches, having that consultation with your doctor is important. Some people go, though, from smoking tobacco to all of a sudden e-cigarettes. For folks out there who don't know what that is, or vaping, explain what that is and then tell us, is that better?
Right.
But define it kind of, if you will, or let us know what it is.
Right.
First.
It's a liquid vial per se that you get, and it ignites it with a battery. So it's a battery powered. So it's not combustible. You're not using a match to light it, but it does ignite because it's got a battery power in it. So is it better? No. There's still laws out there where people can use electronic nicotine devices. That's what the actual word is. We, in the industry, our term is ENDS, is what we call it. The vaporizing vapor, that's industry term. There's up to 3,000 chemicals in one little vial. We don't know what they are.
Oh, goodness.
They're not FDA regulated. So, and when you go into you can go into a vape shop. We actually call it aerosol because that's what's coming out, because it's a chemical that comes out. But if you go into a vape shop, they'll welcome you and they'll say, oh, what type of tobacco products do you use? You say, oh, I use XYZ brand. Oh, well, do you like a particular flavor? And they'll be like, oh, sure, we like, bubble gum or grape or something like that. They'll go in the back and mix up the ingredient for you and have you try it so it can taste just like what you're already using.
Wow.
Now, the flavors are more for the kids than the adults, but it is reaching that college age group as well with the flavors.
Yeah.
So if you just want your regular XYZ brand of tobacco product, they can go in the back and mix it up to match it for you.
Yeah. Well, see, as a mom, that sounds scary to me. So it's like, I don't, I would hope that people would be aware of what's actually going on. And folks like you being able to educate people to let them know this exists, this is happening. Doesn't sound good.
Right.
When we're talking though about smoking though, Marcella, there are other forms of tobacco use, obviously, that people, are using. So all forms of tobacco is basically what you guys are preaching, just don't do it.
Right.
And we're talking.
There's smokeless tobacco, which is spit tobacco. Some other types of tobacco that you may not be aware of are orbs, which look like little Tic Tacs. There are sticks, which look like cinnamon sticks, or like those thin coffee sticks that you can use. But it's actually a tobacco product. And all of them contain nicotine, plus other chemicals. Some we know, some we don't know, because they're not FDA regulated, so we don't know what's in them all. But they all contain nicotine, which is the addictive drug.
That's what you have to remember.
Yes.
Yeah. All right. So much to learn about smoking and so much, help that you can get. We know through the Department of Health you can as well. And we appreciate your time today, Marcella.
Thank you.
This is going to be one of those conversations I think that we continue to have. But hopefully our numbers continue to go down and not up. And the state seems like it's making a lot of progress with getting the word out. So thank you so much for your time again, Marcella Bianco, Tobacco Prevention Program Director with the Tennessee Department of Health. Thank you. And thank